Hi there. Welcome to the From Lab to Launch podcast by Qualio, where we share inspiring stories from the people on the front lines of life sciences. Tune in and leave inspired to bring your life-saving products to the world. Now let's get started with Robert, Qualio founder and CEO, and our show host.
Sam, I am incredibly excited to get the chance to chat with you today. I know you've been interacting with some other members of our team. I'm a big fan of you and everything you and the team are doing at CureMetrix, and I'm really excited to kind of dig in a bit deeper and actually get the chance to ask you a bit about the history today. So I really appreciate you joining.
Likewise, thanks for having me. I appreciate it. It's nice to meet you in person.
Yeah, it is. It is. I'd love to know, how do you folks talk about what you're doing? I think that's a really great starting point, because looking at your website, but in your own words, I'd love to hear how you're building CureMetrix to impact the world.
Sure. So we are an AI technology company for medical imaging, specifically focused on women's health. So our mission is to really help the radiologists improve the accuracy and detection and classification of anomalies in mammography. So our mission is to save lives and support better clinical decision-making, financial outcomes for hospitals and clinics. And we're really not replacing the radiologists. We're really focusing on support services and trying to improve outcome.
Where's the business today?
Busy. There's a lot of backlog. We actually just had our the major radiology conference, which usually takes up the McCormick Center in Chicago, just went virtual last week. So there's a lot of leads. There's a huge backlog as the clinics have shut down of mammograms. They weren't super essential, but now that we're going on a year of the shutdown, there's a huge backlog. So we're really finding a lot of interest in using our AI to sort of process that background.
So are you saying that your technology can help manage some of that backlog? Because this is the big risk, right? Stuff is going on. People are sheltering for a lot of valid reasons, but there's a downside if you're not in the lab looking at things.
Exactly. And we focus, our first cleared product was Sam Triage, and it really focuses on that sort of workflow. So, if you have a backlog of 100, 1,000, 10,000 images or studies, at the very least, everything needs to be looked at. But at the very least, we could flag the studies and the patients that, and pop them to the top and say, hey, listen, really, we think someone should take a look at this.
Yeah. I just realized we're going pretty deep into the detail here. Maybe as somebody who knows how this works in the offline world, might be worth taking a step back. So you folks applying AI to like medical image data, right? Fundamentally to recommend. Maybe you could talk about, without you folks at CureMetrix, how are people managing this today? I think this is illuminating for people to understand the non-technology driven methodology. So
in terms of the technology itself, or the
actual process for like that backlog, right? So in these in radiology departments, how does this work?
So our technology is essentially installed. We install a little service at the hospital or clinic, and it's called the DICOM listener. And DICOM is sort of the major imaging technology that's used widely in radiology, and it's also a transfer mechanism. So we install a service that just kind of sits there, and as the patient comes in and she has her X-rays taken, we're essentially CC'd those images, digital copies of those images. From there, we anonymize it, encrypt it, do all this stuff to make sure that PHI stays on ground, and then we process it in the cloud. So we transmit the images up. We have solutions to scale up, scale down, and what they call inference. So they run our AI against these images. From there, the results are sent back down through that same sort of route, back down to the hospital or clinic. The information is reassociated. And depending on the product, so our triage product is displayed sort of as a work list. So we say, okay, well, this patient who came in today, we flagged them as suspicious or non-suspicious. And so that's it sort of appears as an element of almost a email inbox, it looks like, that you could sort on. And how the radiologists or systems decide to use that are essentially up to them. Some radiologists may decide to work on it first, work on it last, come, have a cup of coffee and come back to take a look at it. Our Sam Assist product is more heads up. So those same results are sent back down so that the radiologist, after she's made her diagnosis generally, can push a button on the viewer and our results pop up as sort of boxes essentially. Say, and it confirms diagnosis. It could say, okay, well, hey, I caught that, or just bring attention to something that might have been missed. Each box has a severity score associated with it, so that the higher the value, the more severe the our system thinks it is.
Yeah. And before your product, I mean, if I'm correct in saying this was pretty much entirely a human error detection system until
Correct.
products like yours.
Yes, we are certainly the first triage product to pass through the FDA for mammography.
Congrats on that, by the way.
Appreciate
Big milestone.
Appreciate that. And the CAD products have been around in various forms, but we are one of the first AI, machine learning driven platforms.
You mentioned that you have a triage product and an assist product, and I know that when you're getting into the stepping in with the human or in place of the human to go beyond informational purposes, there's just a ton of like minefields. I'm sure you're well aware of this, right? But I want to go in there. But I guess to take a step back, I mean, for people listening, right, AI and medical image data, and that's a pretty interesting space right now. How did you get into that from? Because that wasn't a thought in CS, right, 10 years ago.
What's interesting is I'm actually a biologist. So my background's actually in biology. So I went to grad school and for a PhD in neurobiology. And pretty early on, I realized that my interests are way more in the engineering behind the lab bench solution than the experiments themselves, which would take years. So I went to work in the pharmaceutical realm, and to really try to bridge that gap between biology and technology. And I really think that's kind of the future. There's this cross modality, biologists who can program, quality experts who know biology. Certainly biology is easy, but software, more engineering side of things. And that's really what most of us at CureMetrix try to bring. We have physicists on staff, plenty of them, who focus on what is essentially biological question, as well as doctors and the business people, business side, and things like that.
I think that's a pretty common thing. I think you'll notice just from my own reading is you look at new fields or new things that become really important. It's often initially pollinated by people that have these multiple modalities and an interest down the middle. I know something that I heard recently is that if you look at waves and trends, apparently right now in some universities like Stanford, they're seeing the same number of applicants to bio-related courses as they are to CS-related courses. So if you look at that's going to increase the number and frequency of these collisions between these skill sets. I think it's super interesting and exciting for me personally doing what we're doing. Looking at the other part here. So for a lot of people, we look at, okay, we can build an algorithm, we can test this. This is showing us some interesting data. And for non-medical purposes, you can kind of wing it with a X% accurate and it'll get better over time. And it's often a novelty product, right? But what you're doing, the cost of getting it right or wrong is very serious. And you sounds like you've applied a similar technology framework with very different claims, right? This is a triage aid, this is an assist aid. Could you walk through how you figure that out? Because that's an interesting conversation.
Yeah, that's kind of a dive in that. Well, so first off, by claim, everything should be looked at. I think by no one on staff and a lot of I think AI companies in general, certainly in the medical realm, I don't think any of us claim to replace doctors. Certainly not in mammography. It's a very difficult thing that radiologists do. We're an assistive technology, so we're here to help. So it's not a job replacement. It's an assistive framework, and really going in with that mentality, I think, is part of it. To say, listen, we'll see, but we're here to help the radiologist. In terms of the triage piece, honestly, there was a predicate that came available to us, and we took advantage of that. We realized that we could take our, the CAD products we were working on and leverage them as a triage piece. with a very fast regulatory submission timeline for in the mammography space.
Uh-huh.
The CAD product is a longer haul. There's the clinical trials we go through and everything like that. So that's a little bit of a longer piece of that. But yeah, I think having the knowledge, especially at the engineering level of some of these questions, though, is becoming increasingly important in certainly the quality and in the engineering realm. To really, a lot of the discussions we have are saying, how are we going to frame this? How should we frame this product? How should we frame these claims, in the AI, so that, we are honest with ourselves and our regulatory path.
How much experience did you folks have when it comes to the regulatory path before you kind of got too far down this journey? So in terms of the going down this path, right, you had this technology, but I don't think you started off with the claim. I'm curious, how did you make sure that you picked the right claims and you were following the right regulatory path?
Advice. None of us. I've done this. I've done this in the past to the pharma side, but I wasn't at this level of sort of running things. Certainly not from the engineering side. So we've had good advice. We make sure that we partner with very good regulatory staff, yourselves included, Qualio included, has helped us tremendously with the QMS and getting started and everything like that. But partnership is really critical. We need to make sure that we're getting good advice, especially in the startup realm where, everything is, are you cleared, are you not cleared? So.
Any big lessons learned that'd be worth sharing to people, maybe coming out of a new bio program or CS with an interest in biology?
I think it's internally, I could certainly say that it's important that, as I've seen running a team, how important it is to run, a diversity of people, of thoughts, of data scientists, with developers, with biologists, medical, business, and certainly regulatory. So I think that having that cross-modality knowledge is absolutely critical these days. I think a lot of people are coming up comfortable with software, comfortable with computers. But to really try to add some expert knowledge outside of that realm is a real value add. Like I said, I think choosing great partners is critical, whether it's on the hardware space, whether it's on the software space, whether it's regulatory, getting help with our QMS rolling or submission. It's really important to find the right partners to work with. And even though we're small, we have to constantly ask ourselves, we spend a lot of time choosing the right partners for the jobs.
Yeah, that's wise advice. Speaking with you, it kind of sounds like you folks have really executed incredibly well. Or are there any unexpected challenges along that path?
Yeah, certainly. Amassing data is always the critical piece in AI, and it's doubly so in medical AI. We deal with movies, we deal with giant pathology slices, we deal with just even logistics of storage. We're on the scale of some movie studios with the amount of storage that we want to pick up. We banked 4 million and growing images that are within our company, anonymized and annotated by professionals. And that library is literally, most of the cumulative job. For training, for validation, for testing the AI. So really that piece of it is, I think starting out, you think, hey, we're tackling cancer, that's hard enough. But some of the logistics of keeping our data sets clean and their ground truth clear is certainly been a problem that we've tackled very well, I think.
Yeah, the data problem catches a lot of people. Did you find that getting access to data was very difficult, because it's protected and it's protected health information?
Yeah, we take it partner by partner, and we've aligned with various partners and institutions around the world, and to really balance it's important to us to make sure that our AI generalizes across women of different ethnicities and locations and geography, and it's highly variant. That's one reason that mammography is one of the harder radiology modalities. Breast tissues vary from image to image. Even the same patient may be positioned differently in imaging from year to year. So to really build an AI that generalizes to it has been something that we've really tried to. Has been a real challenge.
Yeah, I'm curious, Sam. looking at the performance data today, how does the AI you run compare to the human review, if you can share?
Yeah, so we've run papers on faster reading times for radiologists,
Yeah.
30% reduction in reading time, fewer unnecessary patient recalls, 63% reduction in false positives versus non-AI solutions, allowing for more time for accurate diagnosis and a whole bunch of things like that.
Yeah.
So the numbers are really pointing,
False positive is huge, right?
Yeah.
And
Right,
if you
correct.
accept some of the data shared that false positives cause such huge harm, and I think you will be able to correct me on this. I know some of the reasons why some preventative testing, like people getting breast checks, one of the biggest risks is false positives in populations that want to wait until certain ages in a lot of conditions. 63% seems huge. It's very impressive. Where do you think this can go? I hate to ask you where will this be in 5 years question, but clearly you probably think about this a lot.
Yeah, we definitely do. I think AI is here to stay. It's hard to argue that right now. I think we are pretty much it's been a game changer.
Yeah.
We're accelerating diagnosis. There's increasing momentum on the consumer side. To kind of get where there's a double read and things like that, international, where there's a lack of mammography, of trained mammographers in certain areas. And really it's also, AI is also a game changer from the regulatory perspective. The FDA is constantly dealing with how to advise companies on the regulatory side of it. Self-learning, everything like that is a big issue on the FDA side. And you hear it's almost collaborative. A lot of the discussions that we've had with them early on, where they're looking for feedback from us for what they should be doing, kind of at an incidental level. So
that can surprise people. The big Goliath that is the FDA. I mean, this is new for everybody, and I believe they've been pretty open with they don't have the answers and they're trying to figure it out too. Yeah.
Yeah,
you mentioned one thing I want to touch on for a second, and it's personally, if you look at even our mission at Qualio, you mentioned access to some of these. Like people want things better, faster, and cheaper all the time. But you mentioned something about, well, this technology can actually help access to some of this expertise via AI. I'm curious, do you have any thoughts on how that could shape in the future?
I think some of the things that I get most excited about is really international on that front, and to really bring some of this, the huge backlog in some countries. We're right by near the border in Mexico. There's a massive backlog of images through nobody's fault. It's just there's a lack of trained mammographers there. So if things like our triage can flag early on, or if it's added to a van, a mammography unit that might be present in a rural area, maybe we could close that loop so that the patient won't be lost in the shuffle, like you were saying, and to try to a degree democratize a little bit more some of the diagnosis that we're seeing internationally and the standard of care.
Yeah, that gets me excited when I hear that a lot, because I think that's part of the real value that I can add. I'm curious, Sam, we're kind of coming up to the end of time here, but I heard so far talking about choose the right partners, right? It's I don't think you could say that often enough, loud enough. You spoke about the data. You need good data, particularly diverse data sets. What else would you, for people interested in this space in general, or if you were speaking to yourself before this journey, CureMetrix, I mean, any advice or any resources you point people towards?
For AI in general, or for mammography?
Yeah, I think it's more how technology, particularly things like AI, can be applied in healthcare, right? And maybe the medical image side, if that's an area of interest.
There's a whole bunch of topics, and I think much of it is public, of the Radiology Society of North America, RSNA. I believe it's rsna.org, but we could check on that after. But yeah, there's a lot of, and they just finished their conference. It was virtual this year, and it's a major topic. There's whole floors of it, and various modalities and talks given. So it's a very active topic out there. So I think that's a very good resource to kind of start getting oriented in that realm. So
Yeah, we'll make sure to add that to the show notes. And you mentioned you were at the conference, but you were probably not at the conference at the conference. Tell me how the virtual conference went.
Yeah, I have to admit, I usually am on the ground there in the booth and talking and
Yeah.
demoing. And I think this year we've have an excellent business development and sales staff and medical group that ran, as well as marketing that ran primary. And this year I leveraged them to come get me if needed, aside from the talks that I wanted to watch.
Yeah.
But sounded like it was okay. I think we're all making the best of it. But certainly there's active online traffic for that usually a huge conference. So
It sounds like you think that conferences in person are going to come back.
it's hard to predict the future on that front now, right?
I'm looking forward to going to a conference again. I really appreciate you sharing some of your story here. I'm really excited to keep close, and I'm excited as a company at Qualio we're able to support some of the work that you're doing. So thank you for trusting us, and I'm really excited to see where the future will take you, and I hope to follow you along that path.
Appreciate it. Yeah, and Qualio's been just a great help so far.
Thank you for listening to this week's episode of From Lab to Launch, brought to you by Qualio. If you like what you've heard, please subscribe and give the show a positive review. It really helps us out. For more information about Qualio, our guest today, or to be a guest on a future episode, please refer to the show notes. Until next time.